Hello and welcome to another enlightening episode of MedSynapse podcast series, where we bring you the latest insights and expert opinions from leading medical professionals worldwide. I'm your host, Sadia Khalid, and today we are diving into a crucial topic, which is women's hormonal health, with a special focus on menopause. Menopause is a natural phase in every woman's life. Yet it often brings along challenges that requires understanding and care. And joining us today is a special guest all the way from Pakistan, Dr. Sadia Khalid, an esteemed family physician with over 15 years of experience in providing compassionate care to her patients. Doctor is not just a clinician but also a telehealth specialist, a public speaker, and a member of the Rural Wanka Council working tirelessly to improve healthcare accessibility. So welcome, Doctor, and we are thrilled to have you here today.
Hello, Hethy. Hello, everyone. First of all, I would like to thank you for, considering this important topic, which is menopause. This is the most neglected topic nowadays. And we as a woman should, I think, take the initiative to help other women going through this process.
That is so rightly said, Doctor. So now to start with, Doctor, could you tell us at what age menopause typically occurs and does it vary significantly across various populations?
Okay. Hethy, actually, menopause is a transition phase in women's life, which is marked by basically the hormonal shift. When the women, they stop actually producing eggs. So it usually starts between the age of 45 till 55, but we consider the average age as 51 here in Asian countries.
Yes, I think it is interesting also how these variation also depends on various factors. So could you explain on what factors does these variations depend on?
See, there are certain factors which actually, causes this menopause. That includes, the progesterone and estrogen levels in the female. With the passage of time, when the woman is approaching towards the menopause, basically there's a decline in the estrogen and progesterone that leads to, the hormonal changes, the changes in the woman's life, including the mood swings, the physical and emotional changes the women experience during this phase.
So, how does these changes actually impact a woman's body?
See, basically, because of the decline in the estrogen and progesterone levels, with the passage of time, when the estrogen level decreases, it leads to physical and emotional changes. And when the progesterone decreases, it causes, sometimes disturbance in the menstrual cycle. Sometimes the mood changes occur within the female. So it's the combination of both, the estrogen and progesterone decline that can lead to certain changes. It affects your cardiovascular system, as well as your bone health, your mental health, and your reproductive.
Yes. So now speaking of effects only, Doctor, what are some of the most common symptoms that women experience during menopause?
See, there are certain kind of symptoms which women experience, and it includes hot flushes, Sometimes the women, they have the vaginal dryness, night sweats, mood changes, and the sleep, disturbances. And I have seen a lot of females, they have come across with certain kind of musculoskeletal changes in their body during the menopause. If you talk about the hot flushes, so what hot flushes, it's increase in the sweating. Sometimes the women that experience, the weather is okay, but the women is having a lot of sweat and the hot flushes. Vaginal dryness basically occurs, and the women, they have problems while during intercourse. It's very problematic for them to carry on this, process. And the mood changes includes anxiety, depression, anger. Yes, you have seen your mothers also. I have seen my mother when she is going through the menopause. She is very agitated. With the small little things, they get aggressive. So these are the changes which women experience while having menopause. And the weight gain, which is very important.
I think these symptoms can be indeed very overwhelming also for everyone.
Yes.
So
Yes.
now when it comes to confirming menopause, what diagnostic tests are typically used?
Okay, basically, there are two types of diagnostic tests. As I've already mentioned, because of the decline in the estrogen and the progesterone levels, you can see when we send the ladies for this hormonal checks, they have the decreased estrogen levels. There's another test which is called follicle stimulating hormone test, which is FSH. So this, when we send this test, we have seen the women with a raised level of FSH. So on the basis of these two tests, we say that the patient person, the lady, is going towards the menopause.
I think that is so great to know, and it is also so helpful to have such clarity on how these tests can confirm the transition in women also. So now, doctor, lifestyle also plays a major role. So, what lifestyle modification and dietary changes can help elevate menopause symptoms effectively?
See, lifestyle is very important in a female's life, right? So the women should work on their diet, exercise. They should have a proper diet while progressing towards the menopause. And that diet includes the diet rich in, omega-3, all the antioxidants. They should have the whole grain, a handful of nuts on the daily basis, and exercise. Exercise, usually when we see the females, they're doing some kind of walk or, the light kind of exercises. No, this is a myth. At the time of menopause, the women they can have the strength training, they can have the weight training. That is very important. As we age, the muscles are losing their elasticity also, right? As we're aging, the bone density is decreasing. So the women, they're reluctant in going for the strength trainings, for the weight trainings. But I would recommend all the females who are going towards the menopause, they should not, worry about, they should not get scared while taking the strength training from an instructor, because strength training is very important in gaining the muscle mass, which actually is women start losing while having the menopause. Right?
Yes, I think that's such a practical advice, and it is also so wonderful to hear how even small changes can make a big difference in lifestyle. So now, doctor, what are the benefits and risks of hormone replacement therapy for women who are going through menopause?
See, if you talk about the pros and cons, I always say there are a lot of benefits in taking the hormonal replacement therapy as compared to the risks. HRT basically is meant for the women who has low levels of estrogen and progesterone. And HRT includes the combination of both. We actually, as doctors, prescribe, first we take a history, because history is very important. Whenever you're giving this HRT to any female, we take a detailed history and physical examination. Then on the basis of labs, we actually select the patient whether this patient is fit for, the combination therapy. That includes both estrogen and progesterone, or this candidate is only we choose only estrogen for that patient. So the women who is having hysterectomy, that is the removal of uterus, in that women we prescribe only the estrogen therapies, right? And if the woman is having the uterus intact in her body, we go for the combination therapies. And the therapies this HRT includes, it's available in the form of pills, pessaries, gels, and the patches. So it's the options are available. It depends upon what kind of option the person, the lady is interested in.
Yes, I think that is really interesting and insightful perspective on HRT. And I think a lot of women are unaware of some HRT. So what would your advice to women be on HRT?
See, if you talk, yes, I have forgot to talk about the hazards. Yes, there are certain hazards associated with HRT, but not all females experience this kind of hazards. The hazards include stroke, sometimes the deep venous thrombosis, the clotting of the blood, and the cancer. Breast cancer is also a risk factor. But if you talk about, the benefits, if the person is having, if the woman is going towards menopause, she is going through certain things. As I've already mentioned, that the women, while going through a menopause, the hormonal shift, they affect the cardiovascular system. That includes cardiovascular system. They can have high blood pressure. They can have, the high cholesterol levels. Then if you talk about the bone, as the woman goes towards menopause, because of the decrease in the estrogen levels, the woman is going towards osteoporosis. The bone density decreases as the estrogen level goes down. So for a menopausal woman, estrogen level has to be within the normal limits to keep all the systems intact and in a functional way. So if a lady is taking hormonal therapies in the form of estrogen level, so her estrogen level is okay in the body, it's according to the requirement. So her calcium level, her vitamin D levels will be okay. The bones, they are not going towards osteoporosis. We do prescribe supplements also, along with the HRT, that includes the calcium supplements, the vitamin D supplements, omega-3. But the target should be the estrogen and progesterone. If the estrogen and progesterone are within the normal limits, the rest of the systems will work accordingly. So we always say that if you want to lead a healthy life, you go for, not all women is a candidate for HRT. We can cater these things. We can take, as I already told you, we take a detailed history, then we go for the lab test, then we say that yes, you are a candidate for HRT. But for the rest of the ladies, we always say, they can have the calcium supplements, vitamin D supplements, they can have the good diet, rich in omega-3. So it depends upon the history and the examination and the lab.
Yes, actually, that actually brings me to the next question, that what if women do not prefer non-hormonal treatment? What options are available for menopause symptoms?
See, as not all the females are candidate for HRT, we always recommend that if a women, because of the a low estrogen level, the women born are more towards osteoporosis. We always say that after 40, the women should have a good intake of calcium in her diet, right? The reason being, as we age, the bone resorption, it increases in females specifically because of the low estrogen levels. Not in the males, but females are the more candidate. So I always say that if a woman is going towards a menopause, her bones are going towards osteoporosis. I have seen even a slight, the bump and the touch can lead to fractures in females. Reason being, the bones weakened because of the low estrogen level as they age. So we check the calcium levels and the vitamin E levels in that women, and we just prescribe them the supplements in the form of vitamin D, calcium, B12. So these are the supplements. And if the woman is having, the neurological symptoms including depression, anxiety, we go for, antidepressants, anti-anxiety, but not all females are the candidate of antidepressants and anti-anxiety.
So it is also very much personalized, I think.
Yes.
So now, doctor, as you also mentioned that managing stress is very crucial during this phase. So could you share some effective stress management techniques for women going through menopause?
Yeah, this is a very important question. As we age, going towards menopause, the women, they mostly experience the depression, anxiety, and stress. Yes, there are certain techniques, certain strategies which a woman should adopt to overcome these, symptoms. As I've already mentioned, not all the women are, the candidates for antidepressants. There are certain techniques, certain things which they can adopt to improve their, lifestyles. That includes the cognitive behavior therapy, which is usually given by a psychologist. They can go for meditation. They can go for hypnosis. They can go for, and the number one thing which I emphasize is the exercise. If a woman is having a good, exercise routine, I have never seen that ladies who are, exercising on a daily basis, they suffer from anxiety or depression while going towards the menopause. So a good lifestyle is actually, a building block. The more you are active, the more these symptoms will, bother you. They will less bother you if you are leading a good life. But if you are immobile, you are lazy, so in that case, you have to, suffer from these kind of symptoms, including anxiety. And for these, type of symptoms, we have CBT, cognitive behavior therapy, and as I've already mentioned, hypnosis, meditation, yoga. Yoga is one of the, best thing to release the stress. So these all things, I think the women should, whatever the option is, good for you. If yoga is good for you, you can easily do it. You can go for yoga, you can go for strength training, you can go for exercise, and for CBT. So it depends upon on what stage the depression and anxiety is landing.
I think I also agree with you that stress management is truly key during this period. Now, doctor, moving on to bone health again, what is the risk of osteoporosis or during menopause, and what exercises can help maintain bone density?
Okay, see, as I already told, that osteoporosis is because of the decreased estrogen levels. So because of the low estrogen level within the body, the bones, they start dissolving. The bone's resorption increases with low estrogens. So the good thing is the diet rich in calcium, that includes milk. If a woman is allergic to milk, they can have the other options in the form of, the dairy products. They can have cheese, butter, or like other things, the soya milk. Basically, the purpose of emphasizing on the calcium supplement is because if you are taking a good healthy meal, then the chances of osteoporosis is less. If you are into calcium supplements, if you are taking your dairy products regularly, if your intake is good, then the chances of osteoporosis is less. But if for some reason the woman is not taking, we usually prescribe the calcium supplements and the vitamin D. If vitamin D is there in the body, only then the calcium will absorb. So we give a combination of vitamin D and calcium. And the exercise, as I told you, that exercise, the strengthening exercise is very important in females. They can have do some kind of the weightlifting also. They can use the weights to increase their muscle strength and to increase their the bone strength. It's not just only the walk and exercise. They should indulge themselves into strength training as well as the weight training, which is very important for bone health.
Yes, I think that is an excellent advice, and I think everything brings back to that question of lifestyle modification that is really important. So now, doctor, what about cardiovascular health? What is the risk of cardiovascular disease during menopause, and how can lifestyle changes support heart health also?
Yes. See, if the woman is going towards the menopause, the chances of the high blood pressure, the cholesterol levels, they usually goes on increasing because of the low estrogen level. So, if a woman is taking a proper diet, which is rich in omega-3 fatty acids, and the woman is taking low-fat diet, then in that case there are less chances of having heart attacks. And if the woman is not obese, she's having a perfect weight, then the chances of high blood pressure, high cholesterol, or the cardiovascular disease are less. But unfortunately, in Asian countries, the women they don't emphasize on their health. Usually, I've seen we have seen our mothers, our grandmothers. They are with the age they don't actually look for their how the weight is increasing. They don't emphasize on their own health. So it's very important for a female to have a good check on the weight. If you are obese, you are at the risk of not only the cardiovascular disease, but there are other complications are also there. So if you're obese, you are at the risk of having heart attacks. And during the menopause, this risk increases by like 5 to 10% more. So you have to watch your weight, you have to watch your lifestyle, as well as if you're already having hypertension, blood pressure, so you have to take complete medications during that menopausal phase.
Yes, I think a lot of aspects come into a picture here, especially again, lifestyle changes can actually also significantly improve heart health as well. So I think every woman should look out for all these little minute changes. Now, lastly, doctor, mental health is often overlooked during menopause. So what are the common mental health concerns and what therapy options are available?
Okay. See, with the age, during the menopause especially, the women, they are, as I told you, they are more into, like they're having mood swings, they have anger, aggression, and as we all see, we have been through, like we have seen our mothers also, with the passage of time as they're aging, we have like seen our mothers, our grandmothers being agitated on very little tiny things. So aggression, depression, and anxiety. These are the symptoms that women can have while going through menopause. So you have to see at what level, at what standard the patient is. I go to a psychologist, right? And the depression and anxiety should be catered by a psychologist as well as psychiatrists. But there are certain techniques which we already, I've already emphasized that the women should go for CBT, cognitive behavioral therapy, which should be given by a proper psychologist, hypnosis, meditation, yoga. So as we age, basically the problem is the women, they suffer from cognitive decline. We have seen, they have dementia, a short-term memory loss as they're aging. They have agitation, anger, anxiety. So all these things should be taken care of when a woman is approaching towards menopause. and a good psychologist and a psychiatrist, or combination of both, can help ladies in passing through this phase.
Yes, I think that thank you for shedding light on this, because mental health is often overlooked always,
Yes.
and I think mental health is as important as physical health also. So it should be
But
taken care of.
yeah, sorry to cut you out. Mental health is more important as compared to physical health, because nowadays, if you are not mentally fit, you cannot be a physically fit man, right?
True. That is so rightly mentioned by you, Doctor. So, as we wrap up today's session, Doctor, thank you so much for sharing your expertise and providing such practical insights into women's hormonal health. And it has been an enlightening conversation, and I'm sure our listeners have gained a valuable takeaways from this session today.
Thank you so much for having me here. Thank you so much, Hedvi and your team, because this topic was considered to be the most neglected topic, and even in the media, very less material is available for the menopausal women. So thank you so much. This platform has given a lot of opportunity for the females, especially in late 40s and 50s, so that they can have a good knowledge of what menopause is and how to cope up with all the symptoms while passing through this phase.
Thank you so much, Doctor. And to all our listeners, thank you for tuning into this episode of MedSynapse podcast series. And remember, if you're a healthcare professional who is eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, take care and stay informed.